worked at in Lorraine, we did. But I'm not gonna papoose an 11-year-old. Like, you better get your feces consolidated, as my daddy would say, so you don't cuss, okay? So, clearly I get my cousin from my mama. Okay, somebody else had a question over here? Yes?
Yeah, so if you have, say, two patients, and the one patient cooperates with you, and you get done in, I don't know, 20 minutes, you said. Say another patient doesn't cooperate, and they get done in 40 minutes, and they have like the same procedures. Are you allowed to charge more for the patient that didn't cooperate?
I like that. There is a behavior management code that exists, but I think it's underutilized, and oftentimes with these state-funded insurance plans, it's not going to be billed. So in my private office, I will certainly have a fee with it, and there will be part of when we're doing our treatment plan stuff and parents are signing off on, they'll also sign off if there are things that are not covered by your insurance, then you're agreeing to pay. So I'll try in my assessment from the get-go to identify those kids. And I say, hey mom, do you want to go to the OR? Or hey, your kid could really use some sedation, but we're, maybe he's pre-cooperative, but she wants to give it a try in the office. No, I'll probably bill that. You're gonna owe me this money. If it doesn't turn into a nightmare, then we could either leave it on the account or I'll give it back to you. But my whole thing that I'm trying to prepare for is getting that money up front, because once the work gets done, who's going to pay that bill? Nobody. And I've got better things to do with paying for a collection agency to try to collect my money from people who probably aren't going to give it anyway. So, but yes, to answer your question, there is a behavior management code. I don't know what it is, but I will. and you can assess a fee to it. All right? Any other ones? Cool. So, but yeah, he definitely would have been one where I worked for every little bit of that little $105. Okay. There are Frankel scales that we could use. Frankel's a guy, and I think there might be I think he has a scale F1 through F4. So F1, I just kind of likened it to F1 is no fun. So that's very uncooperative, like double negative, like just bad behavior, like not okay. This was a fight to get through this procedure. So F1 is no fun. F2, maybe they like you. F3, you're cool with me. F4, please come back for more. Like really good kid, come on back. F4 is what you want. So it's a way to identify these kids that no one else really knows that scale, and it helps to give some ideas of how can we start to ask those appropriate questions of the parent to get an idea of where's this coming from. Oh, when I was at the health center in Lorraine, when we were in Puerto Rico, the dentist just held him down and took out all of his teeth. That sort of stuff. So getting an idea of the previous dental history, including traumatic experiences, helps to explain your moving forward, your treatment options. And your treatment deferral. It's okay to do nothing. Like, that is a legit treatment option. But with doing nothing comes risks, and you can't just tell a parent guardian to do nothing. They need to understand if they do nothing, these sorts of things may very well take place. So that would be like, that's your anticipatory guidance that you're providing. Topical fluorides, we know fluorides are going to help to remineralize teeth. Bacteria can't get to their food. Fluoride is not a food for them. And interim therapeutic restorations, or maybe, hey, scoop out as much as you can of the active caries and then maybe put a temporary filling inside. Well, here's Frankel scales. Definitely negative would be your F1. Those sorts of things. Refusal of treatment. Extreme negativism. Lots of fear. F2. A little bit of reluctance. Kind of uncooperative, but maybe you can still get something done. Maybe preventive stuff. So oftentimes those kids who are very afraid because Uncle Johnny, I pick on Johnny. Is there any Johnnies in here? I'm sorry if I don't mean to. My bad. I got to find another name. Put the fear of God in, when you go there, they're going to give you a needle. So you have these kids who are coming in to get their teeth cleaned, which is one of the more easy types of appointments, and they're super terrified because they have gotten that image from a parent or from someone who's related to them. Positive, they're accepting. This is your 3. Cautious behavior, but I think with direction and the right guidance, they can be very cooperative. And then definitely positives, your F4s, those are the ones that, hey, come back for more. They had no issues with the appointment. You had no issues administering care. Everything was grand. Well, there's a number, there used to be 7, but there are more. But basic behavior guidance, communication and communicative guidance. So you've got a sender, that's you, sending a message within a certain context of the message that is being delivered. So in our case, it's in the dental room or the hygiene open bay area, and then the receiver of this child. So they're not going to do well with big words, okay? So there's times where I'll speak to the kid in my, basic terms. Hey, you know what, now I'm going to talk to my friend, my assistant, about what I see on your teeth. So you're gonna hear a whole bunch of numbers or letters and all sorts of stuff, and it's gonna be a bunch of mumbo jumbo. You don't worry about it, me and her are gonna talk. So then I have that moment where they know that I'm not talking to you, so please don't interrupt, so I can talk to my assistant and get an accurate documentation of their clinical presentation. And with a positive pre-visit imagery, whether you have a website, sending welcome packets to new patients that might include a coloring book, something that's friendly, that's getting these kids and their families to say, oh, okay, well, giving them an idea of what to expect when they come into your doors. Direct observation, whether they're in the waiting area, you may very well have some videos for them to see. If it's if they're siblings, maybe the younger sibling could watch by modeling of their older sibling, get the work done so that they have this direct observation of what is to come. And tell, show, do. You tell them what you're going to do, you show them what you're going to do, and then you do it with minimum deviation, all right? So, of course, I never show the kid the needle. It would even scare me if I was in their shoes. So I don't tell, show, do that aspect of it, but I describe what it's going to feel like. So, hey, is it going to hurt? So sometimes my easy answer for my older kids is, you'll tell me at the end. Just try to brush it off. Like, no, it's not that big of a deal. Or, hey, give me your hand. And then I pinch their hand. And then I push pressure. I said, it's going to feel like a pinch and then some pushing. That's it. That's the medicine going in. That's the mosquito bite juice that's going in there. Ask, tell, ask. Those children who are apprehensive, you want to ascertain where this feeling is coming from. That's where you find out if Uncle Joe had told him something, or Big Brother Jimmy told him or her something about their previous dental experiences. Then you tell them how it's going to be different. Hopefully it is different in your hands, that sort of stuff. Oh, I've told kids plenty of times, have you ever heard the phrase misery loves company? And I had a 6-year-old tell me yes. Like, then that makes me sad, because you're saying something like, who's telling you about misery loving company? And so, but this kid was scared to death to get some work done because his uncle had to have a number of teeth extracted and told him about that. So this was on Give Kids a Smile Day a number of years ago, and this family did not have insurance when I was at the health center. So they became my case that I did for free. Did this whole thing, it was a number of extractions, fillings, seal the teeth that actually weren't carious, that sort of stuff, but he needed pretty much 4 quadrants worth of local anesthetic. So I just kind of took it slow and did it so that by the time we finished, at least one side had worked through some first round of metabolism. And his dad started crying at the end of the appointment, and the boy got all a little teary-eyed, and I was like, what did I do? Now I'm done, like I'm sure, yes, you look like a walrus with all this gauze in there, and the kid just said, I don't want to go. And he was just so, not like he was afraid of what, like he actually ended up having such a great time there as I'm taking out like 5 or 6 teeth, but hey, whatever. I don't know what he's gonna get into when he gets older. But so you tell them how it's going to be different, and then ask if they have any other questions to kind of, so they've told you their fear, you've made an attempt to allay those fears, and then you ask them if they have anything else, because maybe your explanation was enough to make them give things a try with you. So that's ask, tell, ask. Voice control, I use this one a lot. I was recently accused of yelling at this kid. It was also a full moon a couple weeks ago, right? So I figured everyone was coming in the office acting a plumb fool. And this child in particular, and he was just cutting up. So I told him, you're gonna stop. we're done. You've been goofing off since you got here. It's over with. I need to do an exam. We need to count your teeth, see if you have any cavities. Stop it. And of course, he went and told his mama that I yelled at him and all this other sort of stuff. I'm gonna beat ass. Okay. Try me. Like I don't know. I need to put a sign on the front door, beware. Like, do you know who you're messing with? Like, I don't get it. But anyway, you ain't gonna beat nothing. Okay? All right. Yeah, anyway, so maybe there's, and I'll tell parents, hey, I had to get a little stern. I mean, 'cause even the hygienist was like, she didn't yell, she got stern. I mean, he was goofing off and she put an end to it. But again, I didn't know he was gonna act a damn fool. I mean, and you're 12. Like, I need you not to conduct yourself like that. But anyway, so I could be all happy-go-lucky, flowery. I love to play music in the office. I really don't care for the overhead TVs that are there, so I usually turn them off, and when kids ask, I just tell them we didn't pay the bill. But cable got cut off, my bad. And but hey, what do you want to listen to? Little boy, I want to hear Ninja Turtles. Somebody wanted some country music, so I'll bring my Spotify out and I'll just play it, throw it in the drawer. So at least it's customized. They can hear what they want to hear. But I get all, yeah. I can, SpongeBob SquarePants, I got you. But if we need to bring it back because you kind of lost your mind a little bit, I have no problem being, hey, let's go to the store. Stop, be still, put your hands under your butt, do not move. Oh, snap, see, right? Okay, so anyway, so that's voice control. So you're changing the tone, the affect, the way that you're spacing your words, that sort of stuff. I tend to get a little bit more staccato when I'm trying to get attention. Nonverbal communication, there's only so much you can do when you have a mask that does this. And it's all over your face, and you can sit up here, I can smile all I want to, and they're just like, can she not see? Is she squinting? Like, is she a good dentist? I was already accused of not doing it right with the anesthetic. So I tend to do a lot more patting on the shoulder, give a thumbs up, that sort of stuff. So nonverbal communication. And when my mask is off at the end of the visit, I'm like, doing a lot more. You did such a good job, that sort of stuff. Or I'll extend my arms and kids will come in for a hug, that sort of thing. Positive reinforcement and descriptive praise. I didn't know kids like stickers were so coveted. So have a whole bunch of stickers. All right, kid. Little girl today, I did five teeth on her. About another 20-25 minutes. Can I have one of your goodie bags? No, goodie bags are for when you come in and get your teeth cleaned. I said, Miss Brittany can stop and get you some stickers. Okay! Stickers and pencils. Now that it's back to school time. So positive reinforcement and then descriptive praise. Oh, you're doing such a great job. That sort of stuff. Kids love, I think, they love their shoes because it's one of the things they get to pick out. So always make an attempt if it's worth complimenting. Don't give them false hope now. Find something else about their outfit. So tell them, oh, those really cute shoes you've got. Oh, now it's getting ready to be boot season and all the little cutoffs and all sorts of cute stuff. Oh, your shoes are really, really cute. Thank you. And then they'll probably tell you, it breaks the ice. I mean, we're not offering, hey, I got some J's for you if you let me get this, do this crown. So that's not what we're doing. But finding other ways to break things down with your kids. Distractions, I use it all the time. So that's what I'm talking about. Oh, I'm going to put my regular fingernail in here, so I'm distracting them, all right? Or if, while you're administering the local anesthetic, hey, move your feet like windshield wipers. When you guys go to take impressions on each other and you feel like you're going to die from alginate impression material going down your throat, and sometimes they tell you, oh, wiggle your feet back and forth, just trying to take your mind off of it. But distraction, let's count down. We're in 5 seconds or 10 seconds with the light, that sort of stuff. Memory restructuring, visual reminders, positive reinforcement, concrete examples, and a sense of accomplishment. So this is oftentimes coming as it's restructuring. So they've already seen you at least once, right? So then it might be, remember how you did last time? But they might have been crappy, but you're talking about how they did a good job, and then so they want to do good again, or they want to do better than what they did before, or maybe the last time was kind of crappy, but they made it through. remember how you had a tough time last time when we gave you the mosquito bite juice? Yeah, maybe this visit doesn't require mosquito bite juice. And now they're already, this is gonna be super quick, we don't have to do mosquito bite juice. Oh, okay, great. But if they know that it's imminent, then maybe you don't. Yes?
What do you do if they had like a bad experience with a different dentist and they come into you? Like, how do you restructure that without like consulting like the other dentist or like?
Oh, throwing our colleagues under the bus?
Yeah.
That's how welcome to Dr. Carey's clinic. I mean, it's really, I can't, because what you don't want to do, unless it's extremely negligent, right? Then of course, you need to do what you've got to do. Or let the parent know whatever. But there's plenty of times where I say, you know what? Show the same 10 teeth, show the same x-rays to 10 doctors, you're going to get 10 different opinions. I may not agree with what happened before. Maybe I'm not saying that part, but more often than not, it's definitely in this clinic I'm at. I'm the pedo doc, the other guy's a general dentist for a lot longer than I've been a pediatric dentist, and we still can't seem to get a consistent treatment plan going. So I'll change stuff in a heartbeat. I just tell my assistant, hey, go tell RP is what we call it, responsible party. I saw something, Dr. Gary just saw something different. She looks at it through a different set of eyes. And this is what she sees. Like today, this one tooth was treatment plan for an MO. And I look at the x-ray, it was 19, first of all. So if I have a kid who needs an MO on a permanent tooth, I'm already looking with skepticism. Like, who said that? They're 8. This tooth's been in their mouth for 2 years. They've already got an MO on do they? So I go and look at the x-ray, and there's like no mesial there. There's no mesial lesion there. So sometimes you paint it like, hey, turned out that the cavity wasn't as big as my friend thought it was. So we just did a quick buzz and easy filling. Cool, little homegirl's not even numb. So she was with this happened. This was my second to last patient. Nana was here. Nana appreciated it. She was like, oh, well, thanks. Tell the doctor appreciate it. I had my assistant go. She was like, how do you want me to word it again? Because it was 2 teeth. I was like, they're not really, they don't warrant like a legit get down into dentin restoration. Superficial, incipient lesions. Let me buzz it out. I was still in the tooth enamel, so technically I can't bill for a filling anyway, so we put the sealant in there. Change the treatment, I don't mind changing the treatment plan for something less when I have to correct someone else's stuff. But I'm not gonna go back to the doc because he's not one of my students. I'm gonna let it go. So there's plenty of times where I don't necessarily agree with. They put up here, maybe root canal and a crown on the tooth, and I go, the caries is extending onto the root surface. So I just say, through my eyes, let's print off this picture and show RP. This is Dr. Carey can't get a crown all the way down on this root. So this tooth can't be saved, or we're gonna have to wiggle it. But don't worry, because the big kid tooth is just right here. That sort of stuff. You just kind of paint it, different, and then say, things are different with me. And you highlight yourself more than you throw shade onto your colleague. Parental presence and absence. At the health center I worked at, everybody could come back. I don't know who the heck started that mess. But parental absence, this is out in Lorraine. And it always seemed like mom was back, 3-4 kids were back. Sometimes auntie was back. Or you might have mom, titi, abuela, and then a couple of siblings. I was like, there's only 2 chairs, but then you got kids doubling and tripling up, and I just, whatever. It's like this, it was already part of the culture that the health center had put in place. Who am I to come in here all these years and make a change? But I love how parents are out of the way at Ocean Dental. And except for these couple ones I've been telling y'all about. So sometimes it's kind of hit or miss. But there are times where you'll use parental presence or absence to get a child to cooperate. I want to see my mom. That's now your ticket. If they're cutting up, then it does sound like an empty threat when I say it like this. It doesn't always come out this way, but if you want to see your mom again, remember, sender, message, context, and receiver. So while I'm not intending to kidnap this child from his mother, in that context, if you want to see her again, you put on some act right, okay? And we can get through this. Or hey, you know what? I'll take you to mom as soon as we're done with this. So if you lay still and keep your mouth open and stop asking me 1,000 questions, then we can get done with this really quick. Miss Brittany and I work really, really well together. We can do this very go as quick as you let us. Oh, okay, well, I want to see my mom. Communication techniques for parents. So it's the same sort of thing. Ask, tell, ask. A lot of what are your concerns? What are your thoughts? Does your child complain about stuff? Where do these cavities come from? I didn't put the cavities in the kid's mouth. Well, he and his mom, the 2-year-old, yesterday, he just keeps getting candy. I said, girl, and when I find a corner store that's hiring 2-year-olds, so he has the income to buy and have a never-ending supply of candy, I said, that's going to be one cold day in HE double hockey sticks, okay? I said, so if you really want to make sure he has limited access to stop buying it. He can't sneak candy if it's not in the house. He can't sneak bonbons if they're not in the house. He can't sneak zebra cakes, even though zebra cakes are one of my faves, if they're not in the house. They're one of my faves. I know how to take care of my teeth. He's 2 and doesn't, okay? So, teach back. Make sure they're listening to you. Hey, Mom, what's the plan? Like, we do post-operative instructions. Mom, so what you gonna do when you guys go home? I'm gonna, okay, let's put Candy Crush away, all right? And we're gonna talk about it. No drinking through a straw, forcefully spitting. No chewy or crunchy foods. We want softer foods for the next few days. No chips, pretzel, cookie, crackers, but things like mashed potatoes, mac and cheese, applesauce, fruit cups, pudding, yogurt, Jell-O. All right, I'm not saying it that fast, so that she's like, wait, what? And tonight, hey, he might be a little oozy. Put a towel over his pillowcase. You might see some pink. That's totally normal. It's going to be the red stuff mixed with saliva. We want to limit physical activity, so we're no running around like a crazy kid. No softball, baseball. Now it would be football practice, sort of stuff for the next couple days while his area is healed. All right. And using motivational interviewing just to kind of get an idea. What was their experience? Where did we fall off the map? Or hey, Mom, you already said like very easily that your 8-year-old had this procedure under general anesthesia when they were his age, and now you've got your second kid who's now a candidate for general anesthesia, and you're pregnant right now. So when are we motivated to kind of break that chain? Like, sure, this is a great way to be able to treat kids, but we really don't want to treat kids this way, all right? We do it when we need to. Every time you go to sleep, there's a risk that you don't wake back up. I'd rather you go to sleep on your own and wake up because you gotta go to work and school the next day than for us to have to use general anesthetic to have your child go to sleep to do treatment that was 99% preventable in the first place, all right? So that sort of thing, you kind of get an idea of, or you have those, I don't know, he don't drink water. I gotta mix it with juice. He doesn't drink water because you probably gave him juice from the get-go, all right? So if it doesn't sounds like what you're saying is going in one ear and out the other, then maybe you just say less and document that you said something, all right? But I wouldn't put all of my eggs, my heart into that circumstance thinking we're gonna change the world. All right, nitrous oxide, oxygen inhalation, we all know that's laughing gas, all right? So we give the two together to make a kid feel like they're in La La Land. I tell parents they're not. I actually don't use nitrous. I'm gonna start because you can charge for it and get paid. Okay, anyways, nitrous makes me feel, I won't say high. It makes me feel like my chest is getting ready to my heart's gonna beat out of my chest. That's just what nitrous does to me. So I learned how to do pediatric dentistry without it. It's not something I like being in the room for. But assistants can go and do some classes and they can be in charge of monitoring. I would feel more comfortable of starting the nitrous and then leaving the room, go do some hygiene checks, that sort of thing. Administer the local anesthetic. And for me, that's the scary part. Kids don't necessarily need the nitrous during the procedure, right? A lot of their apprehension is coming from the pending injection. So even when I was a first-year resident, I'd use nitrous. I'd turn it on, leave the room, come back, get the kid numb, and I put him on 100% oxygen. Nobody knows. Parents are like, oh, at the end, the kid's all still acting crazy. Oh, is that laughing gas still in his system? Mom, he's been breathing oxygen for the past 20 minutes. No. I said, this is your child. That's what you, good luck, see you next time. Right. This is nitrous on the nasal hood. It does provide some analgesia, so it does provide some pain relief or less notice of uncomfortable or noxious stimuli. Amnesia, helps to reduce gag reflex and reduces some anxiety. You want to avoid it in individuals who have chronic COPD. Definitely for pregnant women, especially avoiding exposure to it in the first trimester of pregnancy. Methyl tetrahydrofolate reductase deficiency. These individuals don't clear the nitrous well, so it's contraindicated in the use of individuals with MTHFR. And recent illness kind of let all of that stuff subside so that there's nothing junky in their airway. Advanced behavior guidance, there's 3. Here's a papoose, or protective stabilization. I showed my sister that. She was like, "You're not treating my daughter." And I said, "If she act right, she don't have to go in there." And sedation, so we're looking at either what they call oral conscious sedation, where you drink a cocktail of medicine. Someone was asking about sedation yesterday. Okay. Well, you can drink medicine, or IV sedation is a way. So here's another one. There's certain monitoring that needs to take place when you're giving children oral sedation medication. So you see this clinician is putting on a pulse oximeter, want to make sure that the child is still getting adequate oxygen throughout their body. It's also going to measure heart rate throughout that. And so kids are typically, for an oral sedation, the kid is still awake. All right, they're able to respond to commands, and there's different levels of sedation. You've got your mild, your conscious, mild, moderate, and your general or deep sedation. Okay, you've got your drinking of your medicines, and you progress to more moderate, so more of a cocktail of medicines that can render the patient to still respond to noxious stimuli and protect their own airway, all the way progressing to a deeper general sedation or general anesthetic where they are completely asleep. They are not able to, they have no protective reflexes, and the airway must be maintained for them. That's your general anesthesia, completely in the hospital, okay? Or an outpatient surgery center, or some anesthesiologist will come and perform this procedure. It's more of an IV sedation, which would be your moderate sedation, because the kid is not going to be intubated. So that's like your propofol sort of stuff for kids. All right, clinical application. What does all of this have to do with what we talk about? How to approach the child with your Healthy Smile Sealant programs. Your first clinical patient, I don't think you guys start working on each other than, well, like your prophies and stuff. I think that comes in the spring term. So your legit first clinical experience is going to be with a kid, okay, here at this institution. So you want to be calm and friendly with a smile. One of the big things about the Sealant program is that it's taking place at their school in a non-threatening environment with their friends or their classmates around, and you're doing a non-invasive procedure. You're doing a toothbrush prophy, clinical assessment, clinical examination, and you're providing this preventive service for these youngsters. So smile. It's easy stuff. When you get a hang of it, ask them if they've ever been to the dentist. If so, what happened? So there's your ask, tell, ask sort of thing. Get an idea of what their demeanor and their approach is to you. Explain what you're going to do. Here's where you're going to want to do your tell, show, do. I've got this gray toothpaste. Doesn't taste like anything special. We're going to brush your teeth with it to clean off any lunch or breakfast or sour cream and onion chive, potato chips from the teeth. Then what I wouldn't do was when you put the tips on the etchant and the seal, they all look like needles. So show them without the tips. You can still leave them capped with their regular thing, which is just a blunted little T-shaped thing. I've got this blue soap, and we've got this, it's your pink conditioner if they're still using the same process that we had before, and then the sealant stuff came in a brown syringe. And then we're going to protect your teeth with, I call it a cape, like Superman's cape for the tooth. It protects your tooth from the yucky cavity bugs the same way Superman's cape protects it from the bad guys, which I don't really think that's what his cape is for, but whatever. They don't know the difference. Okay, use word substitutions for the dental equipment and the sealant process. So like, I call it a flashlight, air water syringe, this is my squirt gun, and you can squirt it with it. I mean, that's literally tell, show, do. And this is my canned air, or my special wind I put together just for you so we can blow dry your teeth and blow their hand. Just wanna, it's all that distraction and kind of keeping them active the entire time. Slow speed suction, Mr. Thirsty, or I call it a little vacuum straw. High speed suction is my big vacuum straw. All right, and here's how you can hear it. And I'll say you can put your thumb on it, and then hear when they're putting it on there. And then, oh, okay, that kind of feels weird. Toothbrush and pumice, I call it still toothbrush. Toothbrush equals toothbrush. Pumice is that gray toothpaste. Like you're never gonna see that yucky gray toothpaste anywhere else, but at the dentist. So I got some special toothpaste that we're going to use. Etchant, I call it blue soap. Conditioner, so it's blue soap that you're gonna wash off after it's been on the tooth for 10 seconds, 10 or 15 seconds, whatever y'all's percentage says. Wash off the soap just like you wash off your soap when you're washing your hands. All right. Conditioner, I call like a tooth glue, because when you go to blow air on it after you apply it, it smells like nail polish. That the ethanol, acetone is coming. Everyone's getting drunk tonight. That's coming off of is what's evaporating. And the sealant is white paint or Superman's cape. Curing lights are my blue flashlight. Okay. So introduce yourself. You want these kids to know who's working on them, right? And you should also never want to treat a stranger. As I've ever been to the dentist before, kind of gauge your level of comfort or any level of anxiety. Those 6th graders that you're going to see, I think you guys see 2nd, 3rd, 6th, and 7th, maybe. For those 6th and 7th graders, like this program's been around long enough that those 6th and 7th graders, if they have not left the district, likely got sealed as 2nd and 3rd graders. So there's probably less you have to do. And then there's that restructuring or that recall aspect of things. Remember what happened when you were in 2nd and 3rd grade? Same thing. Toothbrush, soap, all of that stuff. So maybe you have less to do and you can spend more time talking about whatever new cool movie is out there or their shoes. All right. Ask them to have a seat in the chair. Introduce your partner. Review medical history with them, and don't put your gloves on and touch the paperwork. I don't care if they're clean gloves. Someone looking at you with gloved hands holding the paper doesn't know if your gloves are clean or dirty. So please do not hold on or touch any of your documentation with a gloved hand. And then describe what you're going to do for the day. All right? Help yourself out. Who wants to practice dentistry for longer than 5 years? Yeah, I got some early retirees, huh? Okay. I'm not doing this stuff. But so I'm saying that because don't put the chair in this position. Please don't have the kid sitting at this 45-degree angle and you have to access 3 and 14 like this. Okay, let me just put the blue paint in here. You got your light bent all of this way trying to, don't worry, I don't really care about my back or none of that. I'm planning to have a real short dental career. Okay, all right, there we go. See, don't turn 30, please. Even though I turned 30 anyway. Change the subject. So put them down, try to get them as supine as you can, and even still take it from one step there. So they're going to be here, and they're going to be like this, right? So tell them to put their chin up to the stars, because the stars are there, so you can see the 3 and 14. They're laying here. You can see 3 and 14 like this through your mirror. Not, their chin is down to their chest. You still have to do this to look at 3 and 14. Have your patient work with you. Put your chin up to the stars, and then when it's time to do the bottom teeth, if it's easier for you to see, tell them to put their chin down into their chest. So you want to work smarter, definitely not harder. All right? Ask them about TV, all of that stuff, new movies that come out. That's why I like this job. And I finally got a business credit card, so I can't wait to go see Disney movies and stuff and put it on the business. Be like, I went research. And I got me a large popcorn. Okay, I needed to be sustained so I could focus on the lecture. / learn the lyrics of Let It Go. Okay, anyway, ask them if any teeth hurt, help them, and ask how often they brush their teeth, if they do, if anybody helps them. Also, it just kind of helps humble you. I lived in this, like, I'm from not the Cleveland community, but the greater Cleveland area. And like, we were the first black family in our neighborhood. My parents are still married. They'll be celebrating 40 years in November. I had breakfast every morning. I had a parent take me to school we also were close enough so there was no bus that was gonna come and get us. We had a parent took us to school every morning, had a parent pick us up from school every day. I was involved in extracurricular activities, all of that stuff. When I did the Seal It program, it was like a culture shock of my own community. What do you mean you didn't have an omelet for breakfast? What do you mean these are hot fries that you had for breakfast? Not even an apple, not a nasty banana. I don't like banana. Anyway, and I'm the person who, when they make banana pudding, I'm like, I'll just eat the cookies and the pudding. And so, I can't stand bananas. And anyway, they cook gross, and that's besides the point. Sorry, I shouldn't even talk about bananas. But I was going for healthy stuff. There was not a full meal, or these kids are going to school. You guys are going to get there at 9 a.m., and these kids are finishing breakfast at school. I didn't even know that existed. About 95% of the kids in the Cleveland Municipal School District are on the free and reduced lunch program, they eat at school. I mean, they eat key meals at school. I mean, we had breakfast at home, and with school, you had school lunch. These kids are going to school to get nutrition, and that was such wall shocking, me hit it, daggone. Didn't know that happened up the street from where I grew up. I gotta do something about this. So hence, Health and Smile Seal It program made me start to see kids a little bit differently and see my role in the dental profession differently. So I hope this is an eye-opening experience for you all. I'm not expecting to have, how many of y'all in class? 75, 80, how many of y'all, 75? It's a whole lot. I get a lot of money out of y'all. Anyway, just kidding. But if that helps pay my salary, then hey, bring a friend, tell everyone to apply to dental school. I'm just kidding. I hope that you guys see this experience for more than just a clinical sealant thing. There's just so many moving parts. It's such a dynamic experience you guys are going to have. I hope you take full advantage. They call it the Blitz when you guys go out after Thanksgiving break for a solid 2 weeks and do this. It's remarkable. You guys are going to have memories that you'll hold near and dear for definitely at least the 4 years y'all are here, because no one else is gonna know what y'all went through except for y'all. Tell you to look around their mouth, and you're gonna tell their partner what you see. Allow them to look and touch the instruments. Of course, not the sharps. They can hold the mirror, that sort of stuff, if you want them to. I did that for the 3-year-old that I had today. She was not having it, so we'll just hold on to my princess mirror for a little bit. She yelled, "Can you see yourself?" "Yeah." "Can you smile?" "Yeah." Smile in the mirror. So she's just thinking she's about to be doing all of this with a mirror this big. But if it got her to lay down so I could look at her smile and assess her occlusion until I needed the mirror, then she could have done whatever she wanted to with that thing. So you're looking overall. So your diagnosis is really key as to what happens next for this kid. If you see big gaping holes, make sure that your partner puts on there, or as the partner, make sure that you're documenting that there's caries in primary or permanent teeth, or if it's an urgent referral to the pediatric dentist. If you have these kids bite down and their teeth looking like this, make sure there's some sort of a note on there for them to have an evaluation by an orthodontist. All right, just be comprehensive in your approach. If you see something and you're unsure, of course you can't seal until an attending comes over and takes a look. So you can always ask us. One of the things that if I ever go out with y'all, I might find it a little frustrating. If y'all try to tell me something may be wrong. Okay, I want y'all to get to that. Doesn't mean don't say and don't ask me for everything every step of the way. I want you guys to be intuitive in your thought process, okay? But if the kid only has 20 teeth in their mouth, don't tell me you'd like to seal 3, 14, 19, and 30. Because I'm going to look, and then I'm going to say, no, which teeth you want to seal? You're say 3, 14, 19, 30. And I say, you sit here and show me where 3, 14, 19, and 30 are. Okay? And then you're going to say how many. You're going to say, it's right here, right here, right here, right here. And I'm just gonna say, well then where's A, J, K, and T? Because they look just like 3, 14, 19, and 30. But you'll see 3, 14, 19, and 30 if the kid has 24 teeth in their mouth, not 20. Y'all see where I'm going with that? So just be observant and comprehensive in your approach. All right? If you see swelling, abscess, pus, severely broken down teeth, retained roots, all that stuff, put an urgent pediatric dental consultation. And then place the doggonest, best doggonest, flippingest, amazingest sealants you can. Make sure you have adequate isolation, because you don't want to think you place bomb sealants, but you let saliva get all up in there, and so it looks good, we come and check it, and then the kid goes and has a snack later on, and your salivary contamination has totally just loosened things up, and now this kid is unprotected till the next time they're seen. And if they're in 3rd grade, then they're not seen again until they're in 6th grade, all right? Reward them, congratulate them, be that positive reinforcement. Hey, you did such a great job. Thank you for being so helpful. You can keep the cool sunglasses. They give them the little, I call them roly-polies. They're like, I remember back in the day when there'd be an eclipse and y'all got the really deep, dark sunglasses that kind of rolled. Or they might have been the one that looked like 3D glasses. But these ones kind of roll up. So, I mean, they look like Terminator sorts of things when they unroll them. You can keep them. Can't wear them in the hallway. But just, you know, you get those. And your teacher has your goodie bag. Try and reinforce oral hygiene when they're home. Reinforce staying away from sticky candies. So, I mean, you know you got a good assistant when she takes your list. And here's my list, all right? Always up for amending. And stay away from sticky candies. What kind of sticky candies is that? No Laffy Tappies, Now-and-Laters, Gumdrops, Tootsie Rolls, Fruit Roll-Ups, Fruit by the Foot, Mike and Ike, Swedish Fish, Sour Patch Kids, Twizzlers, Twix, Chewing Gum, Starburst, Skittles, Jelly Beans. All right, and now we're at the time of year where candy corn and pumpkins, y'all know what I'm talking about, come into play, and the little caramel apple suckers. All right. Teacher will give them a toothbrush and their goodie supplies, their smile supplies bag when they get back home. So do your research, ask your questions, prepare yourself, commit yourself to lifelong learning throughout this whole process, and take your time. Quality over quantity. No one's expecting you to bust out 4 sealants in 10 minutes your first go. All right, and don't feel ashamed if there's someone in your group that does. Don't assume that there might be crappy sealants, but just make sure that you yourself are doing the best that you're doing, achieving good, adequate isolation, and your partner is evacuating saliva, and then have a really good time. Don't touch the paper or the chart with gloved hands. Please don't make excuses. Don't ignore clinical visual concerns or abnormalities. By the time we come and look, there shouldn't be any I should be affirming what you guys have already seen, okay? So we should say, oh, did we document that they've got a crossbite and they need to maybe go to the orthodontist? That should already be on there because you would have looked at it, all right? Please don't, I appreciate everyone demonstrating their knowledge. But if you come off cocky, like you can't learn anything, then I feel like there's not much I can do for you, okay? So please humble yourself. I love it if you say, this is what I was thinking, Dr. Carey. I think this is what I'm seeing, or this is it, then, what are your thoughts? Because a doggone if on your first try you think you're a better diagnostician than I am, or than Dr. Williams is. You see what I'm saying? Like you're a student. One who should be researching, learning, taking all of these opportunities, but you're not the master yet, okay? Don't rush. And don't waste this opportunity to go mad making a difference. So go ahead and make a difference and really take advantage of this unique opportunity. We might be the first experienced kids. You guys might be. They already had their first experience with me. You all might be a lot of these youngsters' first experience with the dentist or with an oral health care practitioner. So don't waste it. These kids are easily molded, and you guys can really serve as inspiration to them. All right, here's my little, yes?
You talked earlier about siblings and modeling, but is student X able to watch the student ahead of him, or are they just in a line and they see?
So they might all be sitting, you guys are gonna set up wherever.
Okay.
Y'all might be in a hallway, this might be in the cafeteria, as gross as that is, but whatever. It ain't our school, and y'all aren't part of environmental services. to make sure it's all clean before lunch is served. Y'all might be on the stage of an auditorium, so it's just kind of wherever. We've done it in the library, and typically that modeling, likely not, is just not conducive. Unless there was a really apprehensive kid, then maybe they might have someone come. We've been places where, you know, the behavioral health, the special needs classes have come down, and then there might be an opportunity for there to be some modeling there for those youngsters. All right? So pediatric dentition, this is good information for y'all, just to have an idea, because as clinicians, you guys will be dealing with this anyway. But you guys have already started dental anatomy?
Mm-hmm.
Okay, great. So upper right is where we're gonna start, the same way we do in permanent teeth. So upper right, baby teeth are, how do we label baby teeth? Letters. But we still call them numbers, because dentistry, we're special. This is number A. So it's still hashtag A, okay? I don't know, but number A, number B. C, E and F for your central incisors. G, H, I, J, so A, J, K, T was what I was talking about. Look exactly like 3, 14, 19, and 30. Just a little mini version of it. All right? So then A, J, then you're down here K, L, M, N, O, P, Q, R, S, and T. All right? 10 up top, 10 on the bottom. If you see 11 up top, and it's not distal to A, J, K, or T, then that's a supernumerary 2. It's extra. All right? Mixed dentition. I don't know why only 16 is numbered on the maxilla, but for the most part, this is going to be the age range that you guys are dealing with. More often than not, your kids are going to have 8, 9, and 24 and 25 at least. All right? And so you're going to see 3 ABC, 7, 8, 9, 10 HIJ, 14, 19 KLM, 23 through 26 RST, and 30. Okay? I don't know why I walked all the way over here and I got to walk back. So I'm going to stop doing that. All right, clinical scenarios. I'm going to do something different. Can y'all see that good or no? I mean, see that well or no?
Yeah,
Oh, that's better? Okay, great. All right. Anybody see anything different about this occlusion? Crossbite where?